So what attracted me to wanting to be part of the Housecall Providers community is the opportunity to be in something so big, giving back at a time that is just so rough for so many people in so many ways.
So I've been an RN for 10 years, and I've worked in a variety of different settings, everywhere from medical surgical nursing in the hospital setting to community-based mental health nursing. In all of those varieties of positions and different organizations, this has been the best experience I've had by far.
One of the reasons I was drawn to Housecall Providers is because you get your own personal assistant. And there's my personal assistant. His name is Diego. There's sometimes he falls off the bandwagon when it's time to do work, but for the most part, he's on board. All jokes aside, I was drawn to this work due to a personal experience I had with my father, who had a condition that caused his death. And while working closely with this social worker in the hospital, she actually gave me, I would say, the curiosity to get in this field and learn more. While working this job, I've learned that there's a lot of individuals who don't have that support, and it's really important to have that second eye and that second voice to provide them with advocacy.
I really enjoy working as a nurse with Housecall Providers because I am provided with the opportunity to work with patients like Martha, and I'm able to come into their homes and really work with patients long term, finding out barriers that you often don't have time to figure out while you're working in a clinic or in the hospital.
A lot of the patients we serve don't really have any other options. I feel like if we weren't available and we weren't coming out to see them in their place of living, they wouldn't be getting healthcare. And so I think we do have this whole group of patients that we're it. And it's a great feeling to be able to fit that need and bridge that gap for people.
What it was about Housecall Providers was the team, the longevity of the staff, the fact that it was a nonprofit, and I felt like all of the priorities of the company were in the right place. The CEO and I were chatting, and one of the things she said to me was, there's no hierarchy here. Every idea that anyone has, and it's taken just as seriously as somebody who might be in leadership. And that was a resounding, yes, this is where I want to be.
There's a feeling of mutual respect and trust that goes into the work that we do here. And that is felt, I think, throughout the organization. And so there's just a breathability to working in this environment because you know that your quality of work is going to be trusted.
It is unique because you learn a lot of stuff out because you're moving around. So things come up, it's almost like a puzzle, and it's your responsibility to put those pieces together. And because you have a supportive team, there's times where you can call individuals to ask for advice.
I'm part of a team that includes social worker, care and outreach specialist, chaplains and providers, and of course our patients. Our team is really large, and it helps us to provide the patients with really patient-centered care.
Yeah, the live-work balance at Housecall Providers is something that drew me back and that keeps me there. I have 3 kids, and I need flexibility if they're going to have some kind of performance or a game. It's nice to have some control over how the day goes, which is something that you don't get in a clinic-based medicine.
While working at Housecall Providers, I was able to receive my master's in social work. With the support of my team members, I was able to balance my personal life and work. And because of that, I was able to get a promotion, and now I'm in this position.
As an RN, working in any environment, really, there's a diversity in the population that you're going to be taking care of. However, I think with Housecall Providers, specifically, it is part of the mission of this organization to bring excellent care specifically to the underserved. We're going into their communities, we're going into their homes, and we're providing excellent care to them where they live.
When I was growing up, I had the opportunity to go and serve at a camp, a farmer's camp, and I met a lot of people who did not have health care, and it really drew me to the work. And the fact that I speak some Spanish and am able to help with that translation and to bring a little bit of the culture really is a motivator for me to continue this work.
Working at a community-based organization like Housecall Providers is really a privilege. The families need us, the patients need us, facilities and staff and caretakers need us, and they so appreciate everything that we provide.
Starting out as an RN, one of the things that I would notice going into the hospital, there would be a kind of doormat outside of the hospital door, and it would say, "Through these doors walks the greatest staff in the world," or something to that effect. This is the first organization where I've ever really truly felt that that was the case.